Hello and welcome. Today, we're sinking our teeth into the world of modern general dentistry. And to do that, we're going to look at one dental group's info page as a kind of case study. Think of it as a snapshot that helps us get what's really happening in oral healthcare today.
So think about your last trip to the dentist. What pops into your head? For most of us, it's probably that classic image of checking for cavities, maybe some drilling and filling. But what if I told you that picture is completely out of date? You know, the source we're digging into today suggests that it is, and it makes you ask, what is a checkup really for?
And boom, here's why that question matters so much. This one statement changes everything. It's not just about your teeth anymore. This idea takes dentistry from, simple maintenance to a critical, maybe even life-saving part of your overall health. Okay, let's get into our first section, Beyond the Bright Smile. We're going to explore this really deep connection between what's going on in your mouth and, you guessed it, what's happening in the rest of your body.
This right here is the main event. The big idea is that this stuff isn't just about looking good or some kind of cosmetic luxury. No, the perspective here is that your oral health is foundational. A healthy mouth is pretty much the gateway to a healthy body, and if you let it go, it can have some really serious consequences down the line.
So what does that actually look like? Well, the mission is way bigger than just the basics. I mean, sure, preventing cavities and scraping off plaque, that's all in there. But look closer. Spotting signs of oral cancer? Averting other big health problems? That's where a totally routine visit suddenly becomes something much, much bigger. All right, let's see how this all comes together in a real-world example. The source material we're looking at points to Las Vegas as a, and I'm quoting here, hub for quality dental care. So we're going to use it as our case study to see what really makes a modern dental scene tick.
And just so we're all on the same page, we're not actually booking flights here. We're just using the city as an example, as an illustration to get a handle on the trends and tech that the source says are so central to dentistry right now. So what are these big trends? Well, according to this, it boils down to 4 key things. You've got advanced technology, which we'll see more of in a second. Then there's personalized care, meaning your treatment plan is for you, not just anybody. Then a huge range of services, and of course you need the experienced pros to make it all happen. This shows the shift so well. You know, back in the day it was all reactive. You'd go in when you had a problem. Today it's all about getting ahead of those problems, prevention. But the future? That's where it gets really exciting. It's this blend of the tried and true methods with some seriously groundbreaking new tech. Which is a perfect lead-in to our next section. Dentistry's modern toolkit. We've talked about the why, so now let's get into the what. The actual tools and services that are total game changers. Let's start with a procedure that has a bit of a reputation, the root canal. Yeah, I know. For years, it's been the big bad monster of the dental world. But really, its purpose is super important. It's there to save a tooth that you'd otherwise lose, and maybe more importantly, to stop an infection dead in its tracks. Okay, but what if a tooth just can't be saved? Well, that's where the dental implant comes in. The words to remember here are permanent, functional, and natural looking. This is not a temporary patch. It's a pretty amazing piece of engineering that's designed to give you back a fully working tooth for the long haul. I love this slide because it shows the evolution perfectly. On the left, you've got what most of us probably remember, and on the right, the new way of doing things. Digital x-rays are not only quicker, they're safer. We're talking less radiation. And something like Invisalign lets you straighten teeth without all the metal. And then there's this, lasers. The key phrase to know is minimally invasive. Now what that actually means for you is less discomfort, less damage to the healthy parts of your mouth, and a lot of the time, you heal up way faster. It's a technology that has really truly shaken things up. Okay, so we've covered the what and the why. This next part, it's all about you. We're calling it your dental playbook. It's full of practical tips from the source to help you make smarter choices for your own health. So, how do you find the right person for the job? Well, the source breaks it down into a pretty simple 3-step guide. First, just ask around. Start with people you trust. Next, you gotta do your homework online. Read those reviews. And finally, double-check their experience and what they specialize in. You know, for all this talk about cool technology, none of it replaces the absolute basics. Brushing and flossing every single day, that is the foundation. And when you pair that with regular checkups and a decent diet, well, that's your #1 line of defense right there.
All right, let's have a bit of fun with a quick hitter round of myths versus facts. There's so much weird info out there, so let's use our case study to clear up a couple of the big questions. First one up, and it's a biggie. A procedure like a dental implant sounds pretty intense, right? So it's totally natural to wonder, are they safe? Is it a risky thing to do? And the answer is a straight-up no. But, and this is a really important but, the source says they're safe and effective when they're done by experienced professionals. So what's the takeaway? Expertise is absolutely everything. Okay, here's another one I think we all wonder about. We're always told, go every 6 months. But is that a hard and fast rule? Is it the same for every single person? And the answer is kinda yes and no. The source says that, yeah, every 6 months is the ideal target. It's the gold standard. But, and this goes right back to that idea of personalized care we talked about, it can change based on what you personally need. Your situation might be different. So, after all this, the tech, the services, the myths, if you walk away with just one thing, what should it be? It's gotta be this. Everything we've talked about really hinges on that simple act of just showing up for your checkups. It's the key that unlocks everything else. And that just leaves us with one final thought to chew on. We've seen how much things have already changed. So with technology moving this fast, we're talking lasers, AI, digital imaging, it really makes you wonder, doesn't it? What's a checkup going to look like in just 10 or 15 years? It's a pretty cool future to think about.